welcome you.
Great. Well, thank you. We are so excited to be here and thank you all for attending. I know everybody's busy. And thank you, Laura, for continuing to have us and invite us to visit with the students and staff. Falcor is part of the Canine counseling team with animal-assisted therapy. We're part of integrative medicine with UK Healthcare. So you have art therapy and massage therapy, music therapy, and these services are available to all faculty and staff and patients. And so everybody gets advantage of those when you make a request. But for canine counseling, we get to visit throughout, and when you request us, we can pop in and kind of deliver. I say with Falcor, a little bit of fur, we leave it wherever we go. Some of our labradoodles are hyperallergenic, but he leaves a little bit of joy and hair wherever we go too. So thank you for having us. So next slide. Today, I'm just going to take a few minutes of your time to cover what we do as the therapy animals when we're visiting. What is the definition of therapy animals? I've had some people say, so you just come along and we pet your dog? Is that what it does? But there's a little bit more to it. How do you have a therapy animal? Because we really encourage people to be a part of our teams and to join us. It's very rewarding. The dogs love it. I have several. So when I'm at home and I say, who wants to go for a visit? I'm like, yay. It's not just, I mean, here at UK, we do have dogs, but there's a lot of different animals that can be a part of this. What are the benefits? It used to be very anecdotal, but over the past 10, 15 years, we've had a lot of studies and research done. So that's why I think it's really valuable and important for us to share this with healthcare professionals, with our medical and dental students in particular. What is the difference between therapy, emotional, and service animals? We get this all the time. And I think it's really valuable too that people will say, can I pet your dog? Even as we're walking in to come work with the students, the staff, the patients, everybody's like, oh, is this okay? Because we don't know, we see different vests on them. It may say service, ESA, therapy, and we're not sure what to do. So, how do we know? So I'll talk about that for just a minute. And for those healthcare professionals, those students who are learning and working with patients or starting to, what is the benefit and what can they do? And as they're, studying right now, how can they use this at UK? That's really important to know. The benefits in professional settings, it's not just for healthcare. I'm a certified counselor, so I use my partners, my canine partners in psychotherapy, and that's a real benefit too. There's some legal ramifications for that. And again, as students who are studying to become physicians, what can they be considering about this? And what are some of the resources available to them? What's the future? We have a lot of benchmark institutions that we, kind of compare ourselves to, but UK is doing some really great things and getting on board. So we're looking at that as well. So next slide. So the role of therapy in animals' well-being, enhancing our well-being. Doctor, can you pop it? Like I said, it used to be very anecdotal, but now we see there's a positive impact. When people see this big old guy, and Falcor is a Leon Burger, they're known as gentle giants. They walk in. We do have quite a few golden retrievers. We used to have a lot of German shepherds. We had 40 teams pre-COVID here at UK. Of course, that kind of slowed us down for a couple of years. Now we have about 14, 15 teams. Everybody, you can see the smiles on their faces. They just automatically light up. And, the studies and benefits have shown, that improves physical health. Staff retention, stress levels go down. So it's a really great connection. People just kind of, gravitate, and going ahead and petting the dogs, increases a lot of these great hormones that we have. Right now, Pet Partners is who the dogs that work at UK have to belong to a professional organization, and it has a workplace well-being program. So, even if you're not doing it for healthcare at UK, if you know someone who's talking about, gosh, we think it'd be really great for our employees, we encourage them to look at Pet Partners and see what kinds of things can that bring to your workplace. So next slide. So how do we become a therapy animal in the first place? Well, there are lots of different organizations. Therapy Dogs International, Alliance of Therapy Dogs, Love on a Leash is one of the biggest organizations in our area in Lexington, Kentucky. Hope Animal Assisted Crisis Response is one we belong to. We go to survivors of natural disasters and human disasters. I'm also a part of Kentucky Crisis Response Team, Canine Compassion, where we go to survivors and first responders that have worked with, gun shootings, disasters, floods, a helicopter that crashed with 3, first responders on that, teens who've died in car accidents. We go to those schools. So we take our canines and go to those. But with pet partners, it's not just canines, even though that's our largest, but you see a llama up there. We have horses, guinea pigs, rabbits, cats. So a lot of different animals can get certified. And again, people's smiles when you bring in an animal and they're so surprised. And UK has had a lot of, well, not a lot, but a few miniature horses come. And, what greater place than to have UK bring in some horses, and just the joy on everybody's face when those animals come in. For the canines, you can be a part of a, CGC, get, certified that way with American Kennel Club and start to see if your dog is ready. Can they do 10 different commands? Are they, able to follow directions, those kinds of things. Then with these organizations, they give you an evaluation, test your dog. You go through a couple of supervised visits, and then through UK, they check to make sure you're, doing certain things and you're able to be a part of our teams. So next slide. So when you're part of these teams, we have a lot of standards and responsibilities. You can't just willy-nilly bring your rabbit or, cat in to visit with people. And I think that's really significant. Now, there are some different, ways that it's okay if somebody has an end of life care and they want to bring maybe their loved pet in. There's some special ways that you might say, can we bring in our dog or cat because this person wants to say goodbye, and that's between, the physician and the patient to take care of those things. But with our dogs who have gone through these testing with pet partners, there's health and safety standards. Are all the vaccinations covered? And we have a coordinator here at UK who makes sure that's covered. Why is that important? Can your patients, if you're working with patients, get something from our dogs? Some of the things that they think about are salmonella and ringworm. So we want to make sure the dogs are healthy. Can dogs get something from patients? Well, my dogs get flu shots. So I want to make sure, that that's okay. That all of our dogs have vaccinations too. The animals are expected to be well groomed. We have to keep them, their nails clipped because they're going to reach up and a lot of times pretend to shake. And we don't want little kids, getting a cut because that's scary. So we do have grooming things. We try to keep hand sanitizer on us at all times because we don't want to pass germs between patients. So we are washing their vest, anything that might be able to carry something from patient to patient, hand-to-hand contact. When dogs, and he doesn't get up on beds, when he goes into patient rooms, his head kind of hits the bed. But we have a lot of smaller canines or even guinea pigs or cats who can be on the beds. We have disposable pads because we're not going to use a blanket that we take from patient room to patient room and carry those germs. Disposable pads are something for infection prevention. It's really important. So we're using those and carrying them in our bags too. We do have at UK also outside of every room telling us which rooms we can and cannot go into. And we have to be really cognizant of these rules. I know, one time I was, going through the halls, and so often, even if we've already had a patient request, we're going and we're taking care of that. We're meeting with a lot of the nursing staff and other patients, are coming out, their family are saying, oh, please come into our room too. And so we're going in and we're encouraged to do that. And I may not check. And I started to go into one room one day because they were so excited. And then I stopped because the nursing staff were in there covered head to toe, like, the people in ET and all the white. And I was like, wait a minute. And I checked and it was the C. diff room. I was like, wait a minute, don't go. And I had to explain why we can't go in those rooms. And they were disappointed, but they certainly understood. So again, we go through all the training, vaccinations were covered. All of the people who are part of these canine teams have background checks, and we have health screenings. So we have to have all of our vaccinations too. We limit our time between visits. Typically our canines are only going to do 2-hour visits. They take in a lot of the stress. They're absorbing that. They love to do their visits, but they're picking this up from staff and patients. And I've seen staff who are having a really awful day and they just sit down and hold, an animal and the dogs. And they're like, this has just made my day. I needed this. And you can just see their shoulders relax. I've had staff break down crying. Sometimes we've been in the right place at the right time and someone's lost a family member and they're going through grief right then. We're just the drivers. The dogs are very intuitive. They know what to do and they will stay there with the family while they're grieving. But then afterwards, the dogs have to shake. They have stress. They need some time too. So we're our animal's best advocate. And we have to watch too and see when they've had enough and not make them continue on their visits. And so we watch and make sure we're ensuring their welfare and well-being. We keep them leashed at all times. They're always with us. We don't let them wander around rooms. We don't hand them off to other people. So if you see any animals going into the bathrooms with people, that's why. Sometimes it can be surprising. Somebody walks in the bathroom and they're like, oh my goodness, a dog in here. Or riding elevators. So they're all trained to do these types of things. But we ask, is it okay if our dog does a visit in your room? Can they ride the elevator with you? We don't want to impose in these environments where they may not be welcome. Some people are very, apprehensive about dogs. They may be allergic. So we have to be careful when we're doing these types of visits. Next slide. Is there a specific breed? And again, we have mostly canines. Not necessarily. We have all breeds of dogs. We have all sizes. There's Chihuahuas to giant Leonbergers that weigh 160 pounds. My first therapy dog was a giant German Shepherd who weighed 100 pounds. And sometimes, German Shepherds might, kind of scare people a little bit, but he was super cool and super chill. And he taught me more than, about being a therapy dog. So it's more about being tuned in to the temperament of that dog and do they want to do the work? And different dogs are like people. He liked to check in with people very quickly. He'd check a room, see how they were doing. If you needed to stay, great. But if not, it was quick. How are you doing? Great. Good to see you. Bye. The Leonbergers that I work with, they will stay forever. They're very slow. They want to hang. They want to be petted. They are just super chill. So you've got to know your animal, trust them. It's really about the connection and their temperament. So anybody who says, gosh, my dog really loves people, but they don't love other dogs, that's okay. Not all dogs want to be around other dogs. So again, we have a 4-foot rule about keeping from other distance of other dogs. So if your dog wants to be with other people, maybe they're going to be great to be a part of this therapy type work. And we really encourage you to see if it's something you want to do. Next slide. Again, I can't underestimate the positive impact. You may have seen some of the commercials where maybe the child's in the bed and they say, oh, let's bring in a dog. And, while they start to get a shot or something and the child smiles and it does reduce the pain. People have a quicker recovery. It lowers anxiety and stress because they're starting to smile. All of these great hormones, they have less fear and worry. And so again, these aren't just, some of the benefits. There's a lot of emotional, strain that's decreased. And people will say, when we go to visit, it's the nursing staff, it's the other healthcare providers that are like, we're so glad to see you when we come to the ER. And they've had a really tough night. So it's not just for patients. Next slide. So how do they impact our physical health? Like I said, it was anecdotal for a long time, but then they started doing some research, started with nurses. We're actually testing the cortisol levels in their saliva and said when there were positive interactions, we realized that the cortisol levels were going down and there was a really positive interaction. So stress hormones were going down. They had higher endorphin levels, a lot higher nurturing hormones. Some of the research said that when people were having heart attacks and they realized that they had a feline companion at home after heart attacks, they had a greater chance of recovering. So that was like super research to see. Also, when kids have juvenile diabetes, even if they have fish, they found out that by feeding the fish, then they were also remembering to take their medicine and their blood sugar levels being checked. So that was a great way for them to continue. So when we're kind of tying outcome measures and interactions with some of the therapy with pet work, we're seeing a lot greater results. Similar with Alzheimer's patients, when they had fish and they were feeding them, the Alzheimer patients were eating more too. And they had fewer behavioral issues associated with sundown syndrome. So that was great. We've seen that when positive interactions are happening with therapy dog visits, they said, well, people had lower pain-related symptoms. They had decreased catecholamines and increased endorphins. So again, we feel it, but then we're starting to measure these types of reactions. And so it's a really great thing. Next slide. But also, as a counselor, I'm starting to see so many of these things over many years with our mental health. Even before COVID, people were reporting a lot more loneliness. I think it's related to social media. We're tuning into our phones, our iPads. Families are sitting down with, screens instead of, with each other or doing things. We don't just drop in on people anymore. If we did, they think we're a sociopath. So, you have to make an appointment and, coordinate your calendars. So having pets are starting to say, this is really good for our mental health. And, it gives us a sense of routine. Even with COVID, people were not getting up and doing anything unless they had a pet. They had to let out, they had to feed. So it gave them that routine. When I've had pets in therapy, people will just sit there and they had my chihuahua in their lap and were rubbing their ears. They opened up and talked more. We can walk with dogs and talk. So just that walking helps with mental health. When you have people with PTSD, veterans, they show that they have a lot more emotional calming, a lot of intervention with panic attacks. So that's really helping with mental health too. A lot stronger family connections and helping with higher employment rates. So we've seen a lot of studies done that way. So pets foster community connection. People take their pets to, in Lexington, Mirror Twin, bar hops, lots of different things that people are doing. Or if you have pets, they're talking over their fences, or they're taking them on walks, or they're at dog parks. So they're starting to have stronger bonds in social communities, and that's great. Another way is mental health is improving with mindfulness and focus. We're brushing our dogs, or we're paying attention to how they behave. With cats, when cats are kittens, they might meow to connect with their mothers. Then after that, cats only meow to connect with their adults and their humans. And we're trying to figure out, what are they saying to us? How are they talking to us? Are they greeting us? So we're focusing on our animals, and that's mindfulness, to pick up on what's their language, what's their body language. Kids in classrooms too are having better social skills. Parents say, well, when they have pets at home, they're being more empathetic. They're, having better social skills. They're learning to take care of their pets. So we're seeing a lot better behavior, connections, interactions, and we can bring all that to better mental health as we start to use animals in healthcare settings. Next slide. So what's the difference? Is that a therapy dog they have at home? Is that an emotional support dog? Is that a service animal? Where are all these animals being used? Well, service animals are individually trained to perform a task for the benefit of a person with a disability that may or may not be visible, and they're covered under ADA. Therapy animals like Falcor and the animals at the University of Kentucky are there for lots of people. They are specially trained, like I mentioned, through our different organizations. They go through lots of, qualifications, but they don't have any rights. We can't get, benefits to be able to go and have, live in an apartment. We don't get to go to restaurants for any type of reason. We just get to go provide comfort and joy to different people. An emotional support animal provides comfort just by being with a person, one person, and they don't qualify under ADA, but they can have a different right to live in an apartment with a letter from a physician or mental health therapist. Can they be in a restaurant or someplace else? Not necessarily. That's a sticky wicket, because sometimes they will wear vests and go on into different places like that. So sometimes that's where we run into things. That's where also it gives kind of a bad rap for animals who are covered under ADA, and then ESA animals who are not specifically trained may not have the best behavior. And so there become conflict, and we see a lot of these issues all the time. Next slide. So when working with patients, what's the best thing to do? Well, this barcode up here, you can scan and request. It's a cost-free benefit for any of the healthcare folks to have patients, families, caregivers request schedule visits. We go to all of the facilities. We've been to Turfland Mall. We've been to the pharmacy on Wellington. UK's everywhere, all over. So we go to any of those places. You want to confirm if you are, a healthcare provider or staff requesting that a patient is medically and emotionally suitable for a therapy dog visit. You want to make sure that they don't have any allergies or they're not afraid. And I say, they don't have a compromised immune status, but we do go visit the people who are getting chemotherapy and have cancer. We go to those cancer treatment centers. You can put it in their therapy orders, a special request, please have a canine visit. You don't have to say exactly what the purpose is, but if you want to put in, they'd like to reduce anxiety, improve the mood, just for some relaxation. When we do visits with patients, a lot of times patients are like, oh, I'm so glad to see you. But what happens a lot of times is they bring out and say, here's my dog, here's my cat, I miss him so much. And it really, again, gives them time to open up and share. And they're just so happy to have somebody to talk about what's going on in their dog or cat that they miss. And, it does, it makes them feel better just to have that time to talk. Now, one thing is we can't request usually a specific animal, and we don't make promises that the same animal is going to come all the time. We never make promises that we can't keep. So that's really important. This was highway when we were in COVID, and we did the best we could during COVID. We did Zoom visits with our dogs because it would make people laugh, so what was the, protocol when we started coming back? How do we wear masks? We would stand outside people's rooms and just wave, and wear our masks. So we did as much as we could, and it was a lot of fun. Trying to do tricks through Zoom just to make people smile at patients who were like, I thought I had any visitors for 3 weeks, and it's awful. So we do as much as we can. And again, people can request any location, staff, faculty. We do College of Nursing visits right before they have their block exams. Every 2 months, I think it is. We do visits to different colleges. So anywhere that anybody would like to have us, we try to pop up and spread a little support and joy. Okay, next visit. Or next slide. That's a visit. So what are the ethical and legal implications? Well, when we do have, people who are, physicians and becoming physicians, we get a lot of requests for these emotional support letters. There is not a registry where people can say, I have an emotional support animal. That's a scam. And there's a lot of scams online for people to say, hey, you need an emotional support dog or animal, we'll write you these letters for $300. So we tell you, don't go for that. It does need to come from a physician or a mental health practitioner or provider. And of course, as physicians, you can write that, but we do say, it's important that you have a relationship with your patient and you want to document what is it that you're writing this for. Again, you want to make sure too, are you also an evaluator? Are you looking at, is that animal going to cause more stress for your patient, even if you're writing it for anxiety? Can they care for that animal? Is that animal are they going to be able to provide vet care? Can they, a dog this size going to be able to brush it every day? Is it going to be able, are they going to be able to provide food, those types of things? So when you say, sure, they need an ESA, but what else is that going to involve for that? So maybe that's something you need to, think before you start to say, sure, I'll be glad to write that for you. That's really important. So there's a lot that goes into it. When we're doing therapy with dogs or cats, we're looking at, are we tracking interactions and outcomes? So is it therapy, or are we, just doing animal assisted activities where we're just saying, hey, we're just stopping by and checking in and doing those kinds of things? So are you really tracking interactions and outcomes? We have to be very aware when we're at the hospital about HIPAA, client confidentiality. So if someone's saying, oh, can we take pictures? We don't take pictures of patients or anyone unless we have a photo release form that we would keep with us. But we do have lots of people take pictures with our dogs, and that's on them. So we're never taking pictures and posting things. If physicians or dentists, we see a lot of people integrating therapy animals in treatment. Some people have facility animals, and that's perfectly, something that doctors might want to think about. Again, is that, for emotional support, is that a therapy animal? What reasons are you having that? Also, with emotional support, when people are writing those types of things and you're thinking, gosh, is this something they can afford to do? We found that, you can collaborate with the veterinarians. The World Health Organization is wanting to work with veterinarians and physicians to make sure that they can provide financial help. They're One Health organization. So in Seattle, they were working with homeless folks to make sure they had enough financial means to keep their pets with them. So there's some things going on with that. So that might be something as a physician and you say, I think this is really going to help my patient. What are the resources available and what can I do? Because this is significant. So when we look at ESA letters, it's like, gosh, there's a little bit more to it than just writing these for people. So next slide. So again, as I mentioned, lots of benefits in professional health settings, hospitals, healthcare, the dental offices. We're using these in mental health, the school settings when we're doing, pause to read. So children are reading to dogs. Dogs don't have any judgment. They don't care if you stuttered or you said the wrong word or you skipped over lines. They're just happy to listen. Some dogs are trained specifically to work in courtrooms and for advocacy, and they're working with children who may have to be on the stand, and they will sit with them. Again, I mentioned workplace well-being, and there's a Take Your Dog or Cat to Work. So Pet Partners sponsors that. Disaster response, animal assisted crisis response, which I've been involved in. Again, our dogs are trained a little bit differently because it's not a setting where we know we're coming to the hospital and we're pretty familiar and we know the floor is going to be clean. When we do those and we go to a flood situation, our dogs may have to wear booties. They look pretty funny and they walk funny because they're not used to it, but we don't want them to cut their paws. We're not sure what that scene's going to be like. So that's a lot of training. They may have to go through TSA, and if they're going to be a little bit, nervous around a big jet sound. So these dogs are trained a little bit deeper. And that's why, disaster response is a little bit different, more involved with FEMA, Red Cross, and things like that. There are some specific veterinary social workers. They're dealing with compassion fatigue, which is burnout and secondary trauma. We see that a lot with our ER doctors who are constantly dealing with new situations. And those veterinary social workers are working with vets who are having to, put their patients' dogs or cats down. They're dealing with this all the time. Families are dealing with grief. So this is kind of a new area or industry. Law enforcement therapy dogs, not just for search and rescue or for drug detection, but these are therapy dogs that are staying at the facilities and they're taking them to work with kids, but also doing kind of advocacy work. Funeral homes and bereavement are bringing in therapy dogs like Falcor to help with grief. So that's also another area. Next slide. So what's the future? Well, I'm pretty excited because I used to work at UK College of Agriculture too, but they've gotten a huge donation. And in the building that they're doing, they are going to explore the research and bond between human-animal bond and the well-being of companion animals in relation to human health. So they're going to have a whole lot of new things happening and partnering with UK Healthcare on that. The Human Animal Bond Research Institute does a lot of legislation on Capitol Hill. And so they're recognizing the importance of domestic violence, where we've seen a lot of survivors of domestic violence or people in the midst of it will not leave their situations because domestic violence shelters often don't take the animals. So they're looking at how can we bring pet-friendly domestic violence shelters. So if you're a physician and you have a patient who you recognize needs help, care, but is not leaving their situation, you know, what can be done to increase that availability of pet-friendly domestic violence shelters, and how can you help them? So you're improving their well-being for both the people and their companion animals. We also have the Association of Animal-Assisted Intervention Professionals, and it's a community of professionals of OTs, PTs, mental health counselors, school counselors, and other professionals who are working with research, white papers, and the power of animal-assisted interventions. So again, research is continuing to say, how can we, you know, work with our animals and use them to the best of their ability? You know, when we had COVID, beagles were found at like a 96% rate to accurately detect COVID. You know, probably squirrels too, but they were doing great with COVID. So our animals do so much. We've got animals who are working with patients who have POTS and can detect before they're going to pass out or faint, and have them lay down and actually go get them water or a blanket or whatever they need as their temperature drops. You know, so our animals are doing great work. And I think that's really important to say, how can we continue as healthcare providers to look at this human animal bond that we have? Next slide. Okay, so again, these are trained therapy animals. Of course, even if your animal's not trained, I think they all do great work. They all provide wonderful health benefits to us, whether they're fish or guinea pigs or llamas or dogs or cats. And there's a significant difference between ESA, service, and therapy support animals. So kind of knowing that difference is beneficial, so we can be cognizant of who's trained and what are we using them for. And we can take advantage of that in these professional settings, particularly as healthcare providers and at UK, and help our patients. Next slide. So thank you again for giving me this opportunity to share about Falcor and all the great dogs and folks that we have at UK. And let's keep celebrating and learning from our remarkable animals.